Welcome to Unit 8, Lesson 1. Today we're going to be talking about the respiratory system. And for part 1 of the video, which is mandatory, we're just going to do a quick overview of the parts of the system, and in part 2 we're going to look at them in more detail. So by the end of today's lesson, you should be able to identify the various structures of the respiratory system, as well as to be able to explain how the following conditions affect the respiratory system. So let's begin with part 1, looking at the key structures and functions of the respiratory system. So here we have an overview of the respiratory system, and we are going to look at the various parts. We'll begin with these two things up here. If you've ever had an infection in these, you're very aware of their existence. They're actually spaces or cavities within our skull, and they are called sinuses. And they do not exist just to give us pain and infection. They are actually holes in the skull that help keep the skull light, so it reduces the weight, slows air down, for conditioning. Air that enters our respiratory system usually needs to be conditioned first. In particular, it's moistened, warmed, and filtered. And our sinuses help do that. In particular, by slowing down the flow of air, it gives time for dust particles and that to settle out in our sinuses rather than in our more sensitive tissues of our lungs. And one more thing, it helps resonate our voice. So it helps make us better able to project our voice. Then here we have our nasal cavities. Actually, it's just a singular cavity. So our nasal cavity is ideally where the air enters. We should be nose breathers. If we're mouth breathers, we can't treat or condition our air quite as well. So the nasal cavity serves to do all of the three conditioning activities. First, it helps to moisten air, filter air, and warm the air before it enters our lungs. And to help with moistening and filtering, we have bony ridges within our nose, covered with tissue rich in blood vessels, for warming, and cilia and mucus for filtering, and mucus can be spelt with the O or without. Okay. Now, interestingly, mucus traps particles that aren't supposed to enter a land. And then cilia propels contaminated mucus to mouth to be swallowed or spat out, neither of which are really charming, but necessary to protect our respiratory system. Okay, so that's your nasal cavity. Your nasal cavity progresses to the back of your throat. And the region at the back of the throat where your food and airways cross are called, should remember this from the digestion unit. If you remembered pharynx, you're correct. So this is where food and air cross. But at the back of your pharynx and the sides of your throat, you have tonsils. And these often get infected. They're actually not part of your respiratory system, they're part of your immune system. So they include tonsils, which can swell when fighting off infections. So they exist to help fight off those infections. The unpleasant side effect of that fight, though, is the swelling and pain. And of course, these infections enter as we breathe. So you can't see, going down the back is actually your esophagus, and in the front is your trachea. So right here, we're going to focus on, I'm going to color it red so it's a little easier to see. About here is your glottis, which is the opening to the trachea. And the trachea is simply your windpipe, the one the air goes down. And when we swallow, we close that off using, I'll color it blue, right here, the epiglottis. Closes off trachea when swallowing. To prevent choking. So that food doesn't go down your airway. Just below that, and in guys where their Adam's apple is, you can see this quite clearly. Right in this section is the larynx, or the voice box. And what the larynx is, if we were to take a cross section and to look through, your larynx actually has vocal cords that go across it. and we can shorten or lengthen those, tighten them up, and as air goes through them, they vibrate and make different sounds. So containing vocal cords. If you shorten, such as female and young children, or voluntarily shorten, you get a higher pitch. If you lengthen, and this is true of any string or chord, think about a guitar, you lengthen, you get a lower pitch. And guys typically have lower pitch voices because they have longer vocal cords. Okay, so if we go back to this section here and go thicker, you look here down to here, they have little rings across, and you can actually feel these rings. It's cartilage, and you can feel down the front the little ridges. This itself, you can write it up here, is the trachea. Which is so-called your windpipe. And it has C-shaped cartilage rings. That prevent it from collapsing. Because if you think about when the air goes out of a balloon, it collapses. Well, so would your trachea collapse as the air exited if it didn't have these cartilage rings. And they're C-shaped. If you were to think about the C sitting there, it goes around the front of the trachea, and then this open part of the C is at the back where the esophagus is. As well, the trachea contains mucus and cilia to prevent debris from getting down into the lungs. So the cilia beat and bring the debris back up to the mouth to be swallowed. We go down a little bit lower. This then branches over to here, to the left and the right lung. And the branches have a name singular, they're called a bronchus. Plural, they're called bronchi. So you have a left and a right bronchus, and they branch from trachea to lung. And then they further divide. You see all these little divisions here, little tree branches almost. These further divisions are smaller airways, and they are called bronchioles. And there are many little branches. Off. Whoops, I did not mean to zoom into 360. Off of the bronchi, off the bronchi. And they eventually end in little tiny, teeny tiny air sacs. And I've drawn them way too big here, but it's far too hard to show how small they really are. But those little teeny tiny air sacs, do you remember maybe way back in Biology 9 learning what they were called? It starts with an A. Makes me think of the chipmunks. They're called alveoli. So not quite alvin, but that's what it makes me think of. Or singular, an alveolus. And they are billions of them. Of microscopic. Air sacs at the end of the bronchi. Sorry, the bronchioles. So that's the main parts of your respiratory system. Now we're going to take a closer look at a few of the key parts and the overall structure in here. One thing that's not drawn in here are the diaphragm and ribs, and we'll take a closer look at those in another picture. I think we have enough going on here. Probably more than enough. Okay, so that says diaphragm there, but we'll look at it on the next page or two. That's going to be the end for part 1 mandatory portion. So I'll post this video and then only go on to part 2 if you're interested or you've missed class. Otherwise, we'll be doing it in class. If you have any questions, please come see me. Otherwise, I hope you have a great day and I'll see you in class.